Hi, my name is Gabby Geschadmeyer, and this is my medication administration past video. First, before we get started, I'm going to list out the 8 rights of medication. So we are going to be doing the right dose, right medication, right patient, right route, right time, right documentation, right storage, and right preparation. So first, before we get started, we need to check that the medication administration record matches the physician's order. So on Mrs. Jenkins' physician's order, it says Coumadin 2.5 milligrams by mouth daily. So now we are going to check the medication administration record. It says Coumadin warfarin 2.5 milligrams by mouth every day at 1800. So now that we have checked that information, we are able to go forward with administering the medication to Mrs. Jenkins. So basically, warfarin or Coumadin is an anticoagulant, and basically how it works is it interferes with the liver synthesis of vitamin K dependent blood clotting factors. So basically it's going to inhibit blood clotting. It's going to inhibit clotting factors in the blood. So the reason as to why she is taking this medication is because she just recently had a left hemoarthroplasty, which basically puts her at an increased risk of clotting. So that's what we want to prevent. But she also has a medical history that can increase her clotting factors, including type 2 diabetes, hypertension, and atrial fibrillation. Now, this drug does have some adverse side effects, including ecchymosis, hematuria, petechia, hematuresis, and black tarry stools. So we do need to check some lab values before we administer the medication, and this is going to include the patient's INR and their ProTime. And so her ProTime levels were at 18 and her INR was at 2.2, meaning we are able to administer the medication. So when we go into the patient's room, I'm going to knock on the door and introduce myself. Hi, my name is Gabby. I'm going to be your nurse today. We are going to be giving you your Coumadin warfarin. This is because you underwent a surgery and you have increased risk for blood clotting factors, so we're giving this to you to prevent that. Are you currently in a comfortable position?
Yes.
Okay. And how do you like to take your medication?
With water.
Okay. So she just said that she wanted to take her medication with water. So first, can you state your name and date of birth, please?
Miss Jenkins, 01/07/1949.
And then I would take a look at the medication administration record, and it matches. So, Miss Jenkins, do you have any allergies?
No.
Are you currently in any pain?
No.
And to warfarin or Coumadin before, or to any drug, have you had any side effects or adverse reactions to it?
No.
Okay, so now we can get ready to administer the medication, in which we need to do 3 different checks. So the first check of the medication is when I am getting it out of the bedside drawer. So I look at the medication, and I'm going to look at the medication administration record for my first check. So it says Coumadin warfarin 2.5 milligrams, and it matches up. So that's our first check. So now I'm going to put it into the medicine cup, keeping it wrapped. Now, as I put it into the cup, this is when I check it again to make sure the medication is correct. So this is my second check. So now I have water and I have the medication. So when I give it to the patient, this is my third check as I'm unwrapping the medication to administer to the patient. So I unwrap the medication, and now I'm ready to give it to Miss Jenkins because I have checked it 3 different times. Okay, now I need to check if she took the medication. So can you open your mouth for me, and can you lift your tongue up? Okay, I have checked if it went down. And do you need some water? Did you have any difficulty swallowing or anything?
No.
So everything's good, like with the medication and how it went down?
Yes.
Perfect. Okay, so now since we've administered the medication, we just want to make sure that the patient is comfortable before we leave. Are you comfortable?
Yes.
Do you need anything before I leave, or do you have any questions?
No.
Okay. And at this time, we would put the bed in its lowest position, raise the side rails, and we'd put the call light within reach in case that the patient would need us. And immediately after, we would document this administration of the medication. I'm Gabby Gescharmeyer, and that was my administration medication pass video.